We are back on Morning Line. Thanks for joining us. Our guest this morning, Clint Kelly, malpractice attorney here in town, his office in Hendersonville. Taking your calls if you have a question or comment about a case maybe, and I've got some great questions. Talking to him he is just an interesting guy. But before we continue that conversation, we got more calls for you. Is that cool? Let's go to Joni. Joni, good morning.
Hi,
Hey.
I have a question. How long after a procedure is done do you have to file a lawsuit?
Yeah, okay. And stay on the line, but go ahead.
Yeah, 1 year.
1 year, unless
Typically.
a rare exception, right?
If you know what happened to you right after the surgery, it'll be 1 year.
Okay.
And if it's took some time for you to understand the consequences of the surgery, in other words, sometimes people don't discover they've been harmed until maybe a month or 2 or 3 months later, or they may not know what happened to them. They may not be able to identify the cause until a few months after. It's always 1 year from the date that you discovered you were injured as a result of bad care.
Okay, so that gives you a little wiggle room in terms of it not going
Yes.
back to the day of the surgery.
Right.
But that's a tricky one. I'm guessing you have a case that goes back more than a year, huh?
Yes.
I'm sorry, just curious, what was it? You think you had something done wrong?
My daughter was in the NICU unit and came home with E. coli spinal meningitis.
When did this happen?
It's been several years ago, but
Yeah.
they come in trying to tell me that it was from a hair follicle, and which I knew it wasn't.
Is she recovered?
Yeah, she had a slow learning at first, and then finally she's back where she should be.
Good. Well, thank goodness
Yeah.
she made a recovery, because it would have been tough. Now, I will say this, children have a different statute of limitations. Children are permitted to wait until they're 18 to file their lawsuit, and what's done is filed by the parent as their guardian, unless there's been a period of 3 years that's passed. Now, after 3 years, generally every case is medical negligence goes down the tubes, because unless you can prove fraud, that's it. That's the absolute ceiling on that. But I'm real pleased to hear, Joni, that your daughter made a recovery, because that could be nasty, that E. coli.
Yeah.
Yes.
Sean, thank you for your call, or Joni, rather, thank you for your call. Appreciate that. And with her situation, would that have been something to inquire about back at the time? Possibly?
Yes, it would have. Yeah.
And a lot of times sometimes doctors will say, well, we see this condition, let's wait a few months, and maybe wait till after the year expires.
That's right.
Maybe. Do they sometimes do that?
Yeah, they still do it. They'll still march the client along for about a year. And
Let's
then,
watch and monitor this.
Yeah, and then when things aren't better, then they go in and say, well, I'm not better, and then the doctor doesn't want to see him anymore.
And it's past the year of
Right.
statute of limitations. So
Right.
yeah, the idea is right then. I certainly understand Joni and child, and maybe that's the last thing you're thinking about is malpractice. She's worried about the care of her daughter, and you don't think. But boy, at some point you need to step away, perhaps, and ask yourself, and then move on it. At least make that call to you. Just take that moment and do that before a year's up.
Right.
But I'm glad her daughter's doing well now. That's good to hear. Let's go to Brian. Hi, Brian.
Good morning. I called before, and I didn't get to follow up with this guy.
Okay, shoot.
Yeah, so he says there's no correlation whatsoever between the proliferation of medical lawsuits and the degradation of health care, and that it's only the greed of insurance companies that is holding back these poor people from getting their huge medical malpractice settlements. I totally disagree with that. I definitely see a correlation between the proliferation of medical lawsuits, frivolous medical lawsuits, increasing medical cost care, and I do not blame the insurance companies.
Okay.
Brian, where's your evidence?
Well, you show me your evidence.
Well, I
You
can't.
have to just like a lawyer and just come back and re-question me. You show me your evidence where that having more lawsuits is beneficial for the medical industry and people receiving medical health care in general.
Well, it's not a question of whether more lawsuits increases the quality of the care. The question is whether the lawsuit brings compensation for someone who's gotten bad care. That's the issue. And the issue also is if you look at the number of lawsuits, they've been going down. You want your evidence, Brian?
Yes,
For the
I do.
last 8 years, lawsuits against healthcare providers in this state have gone down over 50%. How much lower has your healthcare premium come down?
None, Brian, and you know
That's
that.
the result of influences from Obamacare and federal mandates and different things
Brian,
like that.
we didn't have Obamacare 8
We
years
had the
ago.
best medical care in the world. Now we're not even in the top 10. You explain that.
Well, that's not because of lawsuits, Brian, because we have fewer of them. So again, the question on the table is, how do you explain
I don't think
lawsuits?
there's fewer lawsuits. That's not true. That's just not true.
Well, that's a fact. If you want to call up the administrative office of the court, Tennessee Supreme Court, they will give you the tort statistics for each year.
Follow the entire country, not just isolated here to the state.
Well, all I can speak of is Tennessee because this is where I practice, but they sold tort reform in Tennessee on the theory that,
Well, then maybe we're doing something right in Tennessee.
well, then why aren't your health care premiums coming down?
My health care premiums are going up because of the influence of nationalized health care, Obamacare, and people trying to raise the cost of those. Now, that might be something with insurance companies. All medical care has just got out of hand in the last 20 years.
Brian, if you are...
I'm just glad that I don't get sick that much. I try to stay healthy myself, exercise, eat right. That's what I do. I just think all medical malpractice, that's my opinion. I believe it's just way out of hand, and that's just the way I feel.
Brian, if you're injured as a result of a medically negligent act, the question I'd ask you is, would you file a lawsuit? If you say no, I would not.
Patently somebody else's fault.
Well, that's what the kind of cases I'm going to take. I'm not going to take a case where someone's not patently at fault. I'm not going to throw something up on the wall and see if it sticks. So I ask you, if you were injured as a result of bad medical care, would you file a lawsuit? Yes or no?
Yes.
All right. You just answer your question. So you're going to allow yourself to file a lawsuit, but you don't want anybody else to because you think it's wrong because it's screwing up the system.
I'm talking about frivolous lawsuits. Like
What is a frivolous lawsuit, Brian?
talcum powder supposedly causing ovarian
That's not a
cancer.
medical malpractice case. No, it's not, sir. It's not a medical negligence case. That has nothing to do with a case where someone has injured somebody else in a hospital and puts them in a wheelchair.
I mean, I hear, he's not alone in thinking, and maybe this was something we had heard a while back before much of the tort reform, of the idea of frivolous lawsuits, be it malpractice or other type of lawsuits. We can always go back to the famous hot coffee lawsuit. But, it does seem to me, and this is true, and I've looked into this as well, Brian. I mean, there's no question the number of those types of lawsuits have gone down, and I think part of the reason is the tort reform. And you just say you can't throw and see if it sticks when it's costing you $70,000 a pop for some of these cases. But to me, it just boils down to this. If I've been wronged by someone's malpractice, I want to have the right to sue, and I'm going to. And if that happens a lot, que sera. But I mean, and I think Brian too, if something bad happened to him because a doctor was incompetent, he should have a right to sue for damages.
Brian would be the first guy at my office knocking the door down asking, why don't I get my day in court? And I think what's going on, and I see this on juries from time to time, is Brian has seen people get money for nothing. Mm-hmm. Brian thinks there's jackpot justice out there, that people can file lawsuits and they can get settlements really easy, like the talcum powder cases or some of these others. And I can't speak to the talcum powder case. He may be absolutely right about that. But what I can tell you as a medical negligence lawyer in Tennessee, we don't file lawsuits unless someone is patently at fault. Now, we may end up being proven wrong. A jury may let the doctor or hospital off, but we don't do business like that because we go broke. And the whole idea for us is to keep the courthouse door open, even to people like Brian, so that if something really bad happens to him, he can get his day in court. But it's always the guy who says, we've got a problem, too many lawsuits. When it happens to them, he's showing up at the door.
Right.
Where's my lawsuit? And all I can do is protect Brian's right just like I would protect anybody else's right.
Do you believe that the threat of lawsuits, if you're incompetent, to some degree serves a purpose toward encouraging doctors to do things right? Because they know, if not that they don't care about the patient enough, they just don't want to get sued. Is that a deterrent?
I do. I think it's absolutely a deterrent. And I think, again, going back against what Brian said, I don't call them greedy insurance companies. Insurance companies, by definition, are trying to save money. That's their job.
Sure.
But when you see a certain amount of lawsuits happen, changes are made. It's like those sex clinic cases that you and I reported on. You don't see many more of those right now because they instituted changes to make sure the patients were aware of the risks of this particular procedure. I told
The
you
only
about
reason that came about is because of lawsuits.
blood clots being the
Yeah.
leading cause of death in hospitals. One of the reasons why there have been changes in the care that is designed to prevent blood clots is because hospitals and doctors got sued. And they got sick of getting sued. Who wants to pay money out all the time? So not only are you trying to provide good medical care, but you're also trying to lessen your liability risk. It all fits within a system that in general is good. It's not perfect. It's always going to have some injustices from time to time, but our system of justice as it is currently configured works.
In a perfect world, and for Brian's perspective and yours, is there would be enough of these cases that enough of the doctors get to the point where the mistakes are no longer happening and you're out of business.
Yeah.
You wouldn't like that, but Brian would probably like that. I would like that if there weren't legitimate cases. And again, you say not every case is legitimate. I wouldn't say they're frivolous. Doesn't mean you win them all, but there are a lot out there that I've seen, Brian, that I'm like, wow, what were they thinking? We'll talk maybe more before we take some more calls here about, they need to be held accountable for this. Gosh,
Well, and that may be the best point, Nick, is sometimes people don't even want to file a lawsuit. They just want to know what the hell happened. And I get that. They'll sit down with me and they don't ever ask me how much am I going to make, how's the law work. They sit there, Clint, what happened? Yeah. We know this was the result. Johnny's in a wheelchair, or Billy can't see. We know that there was some issue, like what Lisa said. Lisa's calling it. Says my mom's got torn retina. What happened?
Yeah.
And a lot of times that's what people engage me to do, is find out what happened. And most of the time I'll say I can't bring a case.
Yeah. And those are fair questions to ask, and Brian, he makes a good point. He's going to talk to Lisa, who called earlier. You're going to look at the file, and you can say there's a torn retina and just file blindly a lawsuit because of a torn retina. You're not going to do that. You're going to have to look deeper and see, well, was this just an unfortunate result of quality care, or was there a mistake? And if there was a mistake, I would think if that was your retina or my retina, I'd want the hospital held accountable for it. But you're going to spend some money figuring out whether or not there was a mistake, and there may not have been. And
whether, as Brian says, I can prove someone's patently at fault.
Yeah, gotcha. All right, but that was a good call. I appreciate it. Yeah. Brian, he's not the only one that feels that way, and it was a reasoned argument.
I'm glad he brought it up.
And I'm glad he called. Yeah. Let's take a break on that note. When we come back, Sean and others will get to your call right after this. Stay with us.